Doctors of Reddit, what is a 1 in a million chance thing about your patient you have witnessed? I was a paramedic and I came to a scene where I had a patient who was talking to me, but he had no blood pressure, and no detectable pulse. I couldn't even hear his heartbeat with a high-quality stethoscope. They dumped a few bags of fluid in him in the ED before they were barely able to get a BP on him. Worked oncology for 5 years and I've had several with no discernible BP and one with no palpable pulse. That shit will make your own BP shoot through the roof. Story from last year. After a pretty uneventful pregnancy, a woman goes into labor but it doesn't advance as quickly as it should, so she gets a secondary cesarean section, standard procedure. The baby gets out and its eyeball is almost pressed out of the eye socket. Everybody is in shock, the parents start crying, we don't know what to do. Turns out the child had a huge tumor of the temporal lobe which pushed the eye out. We later analyzed the ultrasound pics and the tumor was already there, so it just got overlooked. Brain tumors in neonates are even rarer than 1 in a million, it's actually 0.3 per million, so I hope I'll never see such a case again. My mother, now retired, was a GP in the middle of nowhere, in southwest France. In the early 90s, she had her first HIV cases. With the med at the time, they did not last long. Except one. Clearly HIV, but not developing AIDS at all. He was one of the few people with natural immunity. Had a very sick child with influenza. Spent 6 months in my ICU. Had a month of blood gases that were not compatible with life. Had multiple collapsed lungs. Hess currently in 6th grade, no ventilator, no tracheostomy, literally no complications for the long term. Inserted a urinary catheter to a female patient. She complains of pain where the bladder is situated, and it was distended. No drainage per catheter. When we pulled the catheter out, there it was, a worm which got stuck inside the tube. How the hell did the worm enter the bladder? Lab tech here. We see worms very often. Disgusting and interesting at the same time. Once when a female patient was submitting a urine sample, a full worm worked its way into the cup. It was Ascaris lumbricoides. Gotta love the medical field. Edit. So sorry that I ruined everyone's lives, smiley face. The more you know. One of my patients nearly died from an amniotic embolism while she was in labor. It's so rare that the only way to diagnose it is by ruling pretty much everything else out first. It's essentially when the amniotic fluid accidentally passes into the mom's bloodstream. She had a cardiac arrest and we did CPR while doing an emergency C-section. She is slowly recovering but has lost most of her brain function. I once saw an N4 drug user who managed to break an old needle off in his vein when injecting and presented with chest pain. It was only when we were doing an angiogram we noticed the needle fragment embedded in his heart. I've never seen this before or since. Needle inside the heart and a drug user, couldn't get it out. Bad situation. I'm a vet. It wasn't the patient so much as the owners. A dog was brought in because it was giving birth. The only thing was that it was male. The woman, late 30, was screaming that she sees the head. In reality those were his testicles. In the end I had to sit and explain to her about the birds and the bees. I once saw a newborn baby who was a true hermaphrodite intersex person. I was part of the meeting with the top pediatricians discussing the case. The patient's gender was clinically indeterminate from external genitalia. MRI showed one ovary and half a uterus on one side and a partially descended testicle on the other side. To decide once and for all they used genetic analysis to analyze the chromosome makeup. However, this showed a 5050 mosaic of cells, some of which were 20 female and some of which were XY male. A very confusing case as to what to do next. Unfortunately I was unable to follow this one up. My aunt and uncle-in-law are both doctors. Once, she was lying on his stomach and she heard something odd in his pulse, blood flow. Went to the hospital that night and he had surgery to resolve an blockage which if it had ruptured he would have been dead in 10 minutes. All by pure chance. This is a true moment straight out of House MD. It both illustrates how dumb luck can determine whether we live or die and how well trained and observant some professionals are. A neurologist I was rotating with once was walking to the parking lot through the emergency department and one of the docs stopped him and asked him to do a quick look-see on a lady he was about to discharge home. We called these drive-by consults. This woman had some vague, Non-specific complaints like headache and passing dizziness, but nothing out of the ordinary, and all tests in the ER came back negative, so she was waiting for discharge. Neurologist spends 5 minutes with her, comes back and says admit this woman and do a stat MRI of her brain. He noticed an extremely subtle vertical nystagmus of her eyes. A nystagmus is basically a repetitive, uncontrolled movement of your eyes which can have dozens of causes. A horizontal nystagmus is what you'll see 99.9% of the time, and it's usually benign in origin. Vertical nystagmus, on the other hand, is a stroke in your cerebellum until proven otherwise. They sent the woman to MRI which showed infarcts in both sides of her cerebellum, and she was in neurosurgery the next morning. If it weren't for that drive-by, she would have been sent home and probably died overnight. Not a doctor. My friend was internally decapitated when he was 47. Today I talked with him, his voice is different, and he told me he's started playing hockey again. I don't know the odds of surviving this accident. But what I do know is, who survives this accident and goes and plays hockey just 18 months later. I put the catheter in, got explosive diarrhea all over scrubs. Catheter goes in, shit comes out, can't explain that.